But nonetheless, let's kick off the show with Rainbow Children's Medicare, which is the first corporate on our show today. The company reported what was a mixed performance in Q1 with steady margins and healthy profits. Remember that they run pediatric and maternity hospitals across the country. But their occupancies have declined year on year as well as sequentially. Dr Ramesh Kancharla, the chairman and the MD of Rainbow Children's Medicare, joins in to talk about the quarter gone by. Hi, doctor. Thank you very much for joining in. Well, if you could just start by telling us about, the occupancy is dipping to around 40%, but your ARPOPs, or your average revenue per occupied bed, rising in early teens. So just give us a sense in terms of what the mix was, which resulted in these two parameters.
Obviously, the seasonal business, which has actually been quite lower, even the last quarter, the Q4, and which continued into the Q1 of FY26. So what we've seen is that the lower pediatric outpatient volumes, as well as the inpatient volumes, and plus pediatric intensive care. That segment of the business has been still a kind of a knot has come up, which is why we see the lower occupancies and footfalls into the hospitals. So what is done well is that, the pediatric surgical work, pediatric specialty work, and also the pediatric quaternary care, the cardiac transplants and neurosurgical in those areas have done very well. So because you've got the better case mix, and also with the surgical, more in surgical, which is actually pushed up kind of your RPOP, because of the big ticket items, as well as kind of shorter ALOS, because most of the pediatric surgeries are actually minimal access surgeries. They actually go home by second day.
So that's just what I wanted to know. I wanted to understand how much was surgical as a percentage of your total sales this time, or as a percentage of your total revenue, as compared to last year.
I think it's grown by at least about 15%, the surgical overall volumes, as well as the revenue-wise.
Right. Dr. Kancharla, if you could, reiterate for the viewers once again your guidance for this year. I remember the last conversation that we had, you had guided for revenues to grow between late teens to about 20% in FY26. Whether that stands, and on, the RPOBs as well, you expected that to increase along with occupancy. If you could give us broad band on all these parameters: overall revenue growth, ARPOBs, and occupancy.
We remain very optimistic about our growth, because 3 more quarters are there that we just started kind of getting into the busy season. That will give us a kind of the late teens to 20% of the revenue growth. And RPOPs, it still depends on kind of what kind of case mix you kind of anticipate and see. If there's going to be a lot more of a tertiary care, intensive care work, definitely RPOPs will be higher. If there's going to be more of a seasonal business, then RPOPs may not be going up significantly. But at the same time, you do drive the top lines, you do drive the EBITDAs. That's what the ALOS gets lower and lower.
You were earlier saying that average revenue per patient could grow 6 to 7% every quarter. Yeah. You refrain from giving a full year guidance, and you are refraining for that now also. But quarterly, we can see this 5-6% sort of improvement, right?
Yeah, I think since this quarter is kind of fairly flattish in terms of the revenue growth, I would expect about 6% growth in average revenue per patient year on year. This is what we kind of guided earlier also. We remain optimistic about the 6% growth.
Okay, 6% growth continue is what you're expecting in average revenue per patient, even in FY26. Dr. Kancharla, what about your margins as well, right? You've seen much better margins than what you've guided for. It's at 25% and plus around that mark, but now you're managing to do 25%. Last quarter was 31%. For FY26, would you want to, up your guidance for that? Do you think you can still do much better than that?
Very unlikely, because we are going to have 3 more hospitals coming in this year, which is all the 3 new hospitals. Almost about 250 beds are going to come into operation. So there will probably some degree of margin pressure, probably 0.5 to 1%. That's what always we see it. At consolidated level, what we expect is about the margins pre-Ind AS would be around 24 to 25. The post-Ind AS will be about 29 to 30. This is how our business kind of we envisage.
Okay. Well, Doctor, I wanted to just come back to the surgical revenue. You said that it's risen around 15% in terms of volumes. Is that probably the trajectory that you all are going to look at? High-end surgeries and surgeries as a whole contributing to majority of the sales in order to sort of negate the impact of maybe lower occupancies? And if so, what would it be as a percentage of your sales?
Yeah. I think it won't happen instantly. It's a kind of a surgical volumes to build in a children's hospital. It takes a longer horizon, and because it's a dominantly a medical hospitals. Surgical business will grow as we add more and more specialties and super specialties, and doing a complex surgeries. That would improve. It's a trajectories over a period of time, over the period of years. So it will still remain a dominantly a medical hospital, the pediatric healthcare. The surgeries will definitely will go up as the kind of our hubs start maturing more and more. We start adding more and more specialty surgeries like neurosurgeries, cardiac sciences,
Sure.
and those specialties in other geographies like Bangalore and Chennai as we move forward.
Sure. Just a quick follow-up that I had. You have said that you're looking at inorganic plans as well. How much cash do you have on your books right now, and what are the type of inorganic plans that you are considering?
I think we have a cash in the balance sheet about 735 crores as on today. So we are exploring an opportunities probably that may cost about cash outflow maybe about 150 to 170 crores. So this is what we were looking at for the acquisitions. So I think we do not really have a many in the pipeline for acquisitions. Whatever is there, we're trying to work on that. So the rest of them are really a greenfield and brownfield opportunities. What we have and what we have in kind of almost 800 beds for capex. I think that more or less we pretty comfortable to kind of fund all our capex through the internal accruals, other cash and balance sheet.
Okay, Dr. Kancharla, thank you so much for joining in with us this afternoon, giving us an insight in terms of what we should be expecting from the company going forward in FY26. So that was the management of Rainbow Children joining in with us.